Welcome back. Over the course of the last week, 60 new cases of measles have been reported across the country. A disease once eliminated continues to grow, raising concerns for those right here in our region. Local 22's Torrance Gosher breaks down what we all need to know in tonight's Health Matters report. Torrance?
Good evening, Glenn. There has been reports of cases of measles. There haven't been any reports of cases of measles, in Vermont, but in neighboring New York and Massachusetts, there have been. I did speak with an infectious disease doctor earlier today on how to keep yourself protected.
I've never seen measles as an infectious diseases clinician, but I'm essentially just waiting for when it happens.
It's only a matter of time, according to Dr. Tim Leahy at UVM Medical Center. A disease that was once eliminated has made a concerning comeback. This year alone, the CDC reports 764 individual cases of measles. In a release statement from the Commissioner of the Vermont Department of Health, Dr. Mark Levine says, quote, "We have the ability to stop vaccine-preventable diseases. In the midst of a national epidemic, now is the time for Vermonters to do all they can to protect themselves and prevent an outbreak from occurring in our state," end quote. Cases of measles have been reported in neighboring New York and Massachusetts. The New Hampshire Department of Health and Human Services says, while no Granite State residents have been diagnosed with the disease, an international traveler was diagnosed earlier this year.
Most places in Vermont have good high rates of measles vaccination, 94.5% across the state.
According to Dr. Leahy, Grand Isle and Lamoille counties have a lower rate of vaccination and would be more likely to see a measles outbreak. So what can you do?
Most people get immune by having an up-to-date vaccination series, and you can check with your doctor to make sure that you've got the right kind of vaccination.
If you are unsure, Dr. Leahy says it is best to check in with your primary care physician.
If you or your doctor are not sure, there's actually a really simple, safe blood test that can tell you if you're immune.
Those results will tell your doctor whether or not you are in need of a booster shot. Dr. Leahy says the biggest takeaway is know the correct information.
What do trusted people like nurses and doctors and scientists say you should do, not just some page on the internet?
Now, Dr. Leahy says by getting yourself vaccinated, you're protecting the most vulnerable population. And for more information on how you can protect yourself and your loved ones, you can find more on our website, mychamplainvalley.com. Glenn, back over to you.